This is the Coronavirus Daily Briefing for Thursday, March 26, 2020. I'm Brian McCullough. Louisiana is becoming a new global hotspot for the disease. How a single soccer game might have contributed to Italy becoming an early hotspot. Possible reasons why the death rate in Germany is so low so far. And is Pinkeye another early symptom of the disease? The worldwide total of confirmed cases of COVID-19 is approaching 500,000. We should expect this number to be increasing by 6 figures a day sometime in the next week or so. Spain continues to surge with 600 additional deaths reported on Thursday morning alone, bringing the total number of deaths in that country to 4,000. However, the rate of fatalities, which is perhaps the key number to be watching right now, has actually slowed in Spain from the 20% exponential growth we had been seeing earlier in the week. More than 13,000 new cases were confirmed in the U.S. yesterday. The nationwide number of cases is passing 70,000, so we should expect that number to hit 6 figures by or over the weekend. The U.S. reported more than 200 deaths in a single day for the first time yesterday, and more than 900 people in the U.S. have died in total. That number might soon pass 1,000 for the first time as soon as today. Speaking of numbers like the ones I just rattled off, Dr. Anthony Fauci was on CNN last night and said this, quote, "The nature of this outbreak that's so frustrating and in many respects a bit frightening and intimidating is it putters along and you think you're okay," Fauci said. "Then it starts to go up a little and then bingo, it goes up in an exponential way. You've got to be realistic and you've got to understand that you don't make the timeline. The virus makes the timeline," end quote. Quoting from the Washington Post, "Pending regulatory approval expected by Friday, technology company Dyson will rush to produce 10,000 urgently needed ventilators ordered by the British government," the company said. Britain's National Health Service originally had only 8,000 ventilators, prompting the government to appeal for more than 20 to 30,000 more. According to some estimates, however, the country may need up to 60,000 in total, the Financial Times reported. Dyson said it is developing its Covent ventilator in record time. According to the company, it will, quote, "achieve a high-quality air supply to ensure its safety and effectiveness," end quote. Just getting basic medical supplies such as masks and gloves remains a challenge in Britain. Some 4,000 British healthcare workers recently sent an open letter to Prime Minister Boris Johnson decrying an, quote, "unacceptable shortage of medical equipment," end quote. As a further example of why social distancing is necessary, let's look at an event in Italy, pre-social distancing, that some people think might have directly contributed to outbreaks we are seeing today in that country. We've been talking a lot about Bergamo, Italy, as being one of the epicenters of Italy's outbreak. Well, it turns out that there was a huge sporting event in late February which might have gotten a bunch of Italians together at exactly the wrong time. Quoting the Washington Post again, "The February 19th Champions League contest reportedly drew over 40,000 residents of Bergamo to nearby Milan to see their hometown squad Atalanta take on Spain's Valencia. Atalanta's 4-1 first leg victory in the upstart side's inaugural trip to the knockout rounds of the world's most prestigious club competition had those closely packed residents and thousands more back home hugging in raucous celebration. Weeks later, Bergamo has earned the tragic distinction of being the hardest hit province in the hardest hit region, Lombardy, of Europe's hardest hit country. Among the sad explanations for the plight there is the soccer match, the mayor of Bergamo, a town of approximately 120,000 that has the same name as its province, said on Tuesday, quote, "Some 40,000 Bergamo inhabitants went to Milan to watch the game. Others watched it from their homes, in families, in groups at the bar," said Mayor Giorgio Gori. "It's clear that evening was a situation in which the virus was widely spread," he added, end quote. Now quoting from the New York Times, "Louisiana is experiencing the fastest growth in new cases in the world, according to one study. Governor John Bel Edwards said that the current trajectory of case growth in Louisiana was similar to those in Spain and Italy. This week, President Trump approved the governor's request for a major disaster declaration, which unlocks additional federal funding to combat the outbreak. The situation in and around New Orleans is particularly acute, with the city reporting 827 confirmed cases as of Wednesday night, more than the total number of cases in all except 15 states. Hospitals are overwhelmed and critical safety gear is running low. Orleans Parish, which shares its borders with the city of New Orleans, has suffered the highest number of deaths per capita of any county in the nation. Of the parish's 37 deaths, nearly 3 times the death toll in Los Angeles County, 11 are from a single retirement home where dozens more residents are infected, end quote. The Department of Defense has issued a stop movement order for nearly all personnel, affecting as many as 90,000 service members who were expected to deploy in the next 60 days. New Jersey is evacuating a nursing home in Woodbridge because officials believe every single one of the 94 residents in that nursing home might have contracted the virus. Hospitals across the country are debating universal do not resuscitate orders for coronavirus patients, regardless of the wishes of the patients themselves or their families. Thus, if you are in the hospital and you are under care for COVID-19 and you flatline, hospitals are now seeking clarification as to whether or not they should just let you go in order to prioritize care for patients that have not yet reached the worst stage of the disease yet. The governor of Mississippi yesterday signed an executive order that banned gatherings for more than 10 people and limited visits to hospitals and healthcare facilities. But, quote, his order also appeared to declare that many Mississippi businesses are essential and would not be shut down under the state's social distancing requirements. As written, Governor Reeves' directive appears to supersede any conflicting orders by mayors, some of whom have issued far more sweeping restrictions. Late Wednesday, those officials were scrambling to receive clarity on the order, according to Mississippi Today, end quote. In other words, if local cities declare lockdowns in Mississippi, the governor's order seems to attempt to supersede those orders, allowing businesses like gyms, movie theaters, and clothing stores to remain open. The United Kingdom is hoping to introduce mass home COVID-19 testing using a new device that offers coronavirus test results within 10 to 15 minutes. Public Health England, the National Health Protection Agency, has bought 3.5 million of the tests and plans to order millions more. They will be delivered to homes by Amazon and be made available at those physical retailers that have remained open, such as pharmacies. Quoting from The Guardian, Professor Sharon Peacock, the director of the National Infection Service at Public Health England, told members of Parliament on the Science and Technology Committee that mass testing in the UK would be possible by next week. The test, which looks like a pregnancy test and involves pricking the finger to produce a drop of blood, which is then analyzed by the device, will first be validated in Oxford to ensure that it works as well as scientists hope. That will happen this week, Peacock said, and it will then be available to test healthcare workers and also the general public. The test is an antibody test, which detects the presence of IgM, an antibody which arises very early on in the infection, and IgG, which is increased in the body's response to the virus, end quote. The availability of a near-instant ubiquitous test is being hailed as a potential game changer in a country that has recently adopted lockdown measures similar to those already implemented in large parts of the world. Frontline health workers and the general public would be able to know if they have COVID-19 and also if they have recovered from it, therefore hopefully being immune for some period of time and thus able to resume their normal activities. That could make the resumption of normal life and the reboot of the economy happen in Britain sooner. Similar tests are under rapid development here in the U.S., though the CDC has yet to announce a timescale for their availability here. Widespread testing could be key to President Trump's aspiration of opening up parts of the country and economy by Easter, with those who are already immune possibly able to return to work by then. Once again, as cases explode around the globe, there is growing concern that young people are not as comparatively safe from COVID-19 as experts had once hoped. Quoting BuzzFeed News, it is increasingly clear that early data out of China was an anomaly. As the pandemic ratchets up with over 500,000 cases and counting worldwide as of Wednesday, it's increasingly clear that the coronavirus is severely harming substantial numbers of people under the age of 50. In New York City, health officials said Friday that of 1,160 people hospitalized with COVID-19 symptoms, 1 in 4 were between the ages of 18 and 49. That squares with what appears to be happening nationwide. Across the United States, about 38% of coronavirus patients sick enough to be hospitalized were ages 20 to 54, the CDC reported last week. Young people outside the U.S. have also been severely affected. In Spain, about 18% of hospitalized patients are under 50, according to the latest data. And in South Korea, more than half of confirmed cases are under 50, with the ages 20 to 29 being the largest age group. The government doesn't break down how many of those cases required hospitalization. Anecdotal data out of the UK, where demographic data on patient ages has yet to be released by the government, also suggests that young people have needed intensive care in hospitals, end quote. Because only a small proportion of the reported severe cases in China, 2.5%, and the critical cases, 0.2%, were under the age of 10, officials all along have been assuming that the youngest patients were being spared the worst. Quote, I'm just not sure we can extrapolate from the published Chinese data to what the experience will be like in the USA, said Andrew Neumer, an associate professor of public health at the University of California in Irvine, end quote. And even if data from China can be trusted, even with its rosy outlook for younger patients, research in the UK has estimated that around 9% of people under 50 in Britain would require hospitalization because of COVID-19. And that was going off of Chinese data, as I said. So if that number is wrong, or if the virus has changed the demographics of impact in the subsequent time frame, then that could be a low number. Quoting BuzzFeed again. There's another grim explanation for why older adults are dying in such higher numbers compared to the rest of the population. It might not be because older patients are the only ones with severe cases. Doctors, faced with a perilous shortage of equipment, may be forced to make the heart-wrenching choice to keep younger patients alive instead. Quote, we'll see more younger people being saved because these ventilator technologies can save lives, and we'll see more younger people's deaths being delayed, Neumer said, end quote. Germany, at least thus far, has a significantly lower COVID-19 death rate than the US, France, Italy, China, and Spain. Why is Germany's death rate so low? Writing in the Washington Post, Loveday Morris, the paper's Berlin bureau chief, explains, quote, the biggest reason for the difference, infectious disease experts say, is Germany's work in the early days of its outbreak to track, test, and contain infection clusters. That means Germany has a truer picture of the size of its outbreak than places that test only the obviously symptomatic, most seriously ill, or highest risk patients. Quote, at the beginning, when we had relatively few cases, when it came to finding them and isolating them, we did quite well in Germany, said Reinhard Bussi, head of the Department of Healthcare Management at the Berlin University of Technology. That's the major reason, end quote. Other factors such as the age of those infected and the timing of Germany's outbreak also play a role in the differing death rates. But testing widely has been the key. Germany, with 31,000 cases at midday Tuesday, appeared to have a larger outbreak than France, which had 20,000. But the higher death rate in France implies that there were more undiagnosed cases there. France's outbreak could be larger than Germany's, end quote. Germany's death rate is 0.4%. That compares to 1.3% here in the U.S. and in South Korea, and is much smaller than the 4% reported by China, 6.8% death rate in Spain, and 9.5% death rate in Italy. Early and widespread testing was key, according to Morris's reporting. Quoting from The Post, initially, at least, the country's health authorities tracked infection clusters meticulously. When an individual tested positive, they used contact tracing to find other people with whom they had been in touch, and then tested and quarantined them, which broke infection chains, end quote. Another factor, many of the early cases were among young people returning from travels abroad. As Germany's older population becomes infected, it's expected that the death rate among those folks will climb, given the increased vulnerability of older people to the virus. However, what's clear is that the early use of widespread testing and contact tracing has given Germany a lead in responding to the outbreak. Here's Wired's take, which echoes exactly what the Post said, but also added this. One grim suggestion is that while Italian hospitals are being overwhelmed by patients, Germany is stemming the tide. Quote, another contributing factor is the health surge capacity, says Martin Hibbard, professor of emerging infectious diseases at the London School of Hygiene and Tropical Medicine. Clearly, if you can't give intensive care to the most severely ill, then that will have an impact as well, end quote. Germany has one of the highest numbers of critical care beds in Europe. According to data from 2011, Germany had 29.2 critical care beds per 100,000 people. Italy had 12.5, while the UK had just 6.6. Germany's figures put it way above the European average of 11.5 beds per 100,000 people. Quote, the German healthcare service has a lot of spare capacity, more so than the UK or Italy, says Hibbard. Their health services have not yet been overwhelmed by it, end quote. This, combined with a more forgiving distribution of infections, might account for the lower case fatality rate, says Matthias Stoll, a professor of medicine at the University of Hanover. While northern Italy's hospitals, already low on intensive care beds to begin with, have become overwhelmed with cases, in Germany, infections have been more evenly distributed. There's just a bit of luck involved in these things, as well as to who gets infected and whether those people have significant mixing patterns, says Michael Head, senior research fellow in global health at the University of Southampton, end quote. Remember when the coronavirus outbreak first started, and the first thing you probably heard was everyone telling you not to touch your face? That was because scientists were worried that the virus could spread through the eyes. Now, the American Academy of Ophthalmology has warned eye doctors that pink eye might be an early symptom of the coronavirus, quoting the Washington Post. Patients with conjunctivitis, also known as pink eye, who have other symptoms, including fever and respiratory problems, could be infected with the coronavirus, according to an alert the Professional Medical Association released Wednesday. Pink eye is an inflammation of the thin, clear tissue that lies over the white part of the eye. The Academy cited a recent study that found about 1 out of every 30 coronavirus patients in China reviewed had pink eye, end quote. And quoting from today.com, the group advised eye doctors to be on the lookout for patients who complained of pink eye, with symptoms including redness, swelling, and sometimes a sticky discharge in one or both eyes, and who also had fever and respiratory symptoms such as a cough or shortness of breath, end quote. Also, a nurse at the Life Care Center in Kirkland, Washington, which was that nursing home that had that horrific outbreak a few weeks ago, told CNN recently that she observed many of her patients had particularly red eyes, quoting again from Today. They have, like, allergy eyes. The white part of their eyes is not red. It's more like they have red eyeshadow on the outside of their eyes, Chelsea Ernest told CNN. Such redness around the eye is currently the only report of this phenomenon the American Academy of Ophthalmology knows about as of this time, said Sonal Tuli, a clinical spokesperson for the group. Quote, in terms of a red shadow around the eyes, not on the white of the eyes, there is not enough data currently to suggest this is a symptom of COVID-19, Tuli said in a statement to Today, end quote. Indeed, as with the warning earlier about losing your sense of smell possibly being another early warning symptom of COVID-19, it is, of course, worth remembering that any number of illnesses can cause eye redness, not the least of which is seasonal allergies. Stamps.com brings all of the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. I've been telling you about how this allows you to stay inside and avoid crowds like we all should be doing right now, and I've told you how this will help small businesses continue to function even while working remotely. But did you know Stamps.com also saves you money with discounts you can't get at the post office? You get 5 cents off of every first-class stamp, for example, and up to 40% off USPS shipping rates with Stamps.com. And now, in addition to offering discounted U.S. Postal Service rates, Stamps.com also offers UPS services with discount rates up to 62%. Plus, with Stamps.com, you won't even have to pay UPS residential surcharges. Stamps.com is a no-brainer, especially now, saving you time and money and keeping you safe in these crazy times. Right now, listeners to this show get a special offer that includes a 4-week trial, plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing, BRIEFING. Stay safe, everyone. Spending more time inside and alone than usual, it's easy to get stuck in anxious thought loops, like worst-case scenarios, what-ifs, ruminating about the past or projecting into the future. With social distancing, we need support now more than ever. Talkspace Online Therapy gives you the support you deserve on a schedule that works for you. Talkspace lets you match with a licensed therapist from the safety of your home. Get 24/7 messaging access to your therapist on any device and hear back daily. Talkspace therapists have experience treating a range of issues, including depression, anxiety, substance abuse, trauma, relationship issues, food and eating, and more. Security, safety, and privacy are top priorities at Talkspace. Their platform encrypts and securely stores all client information using the same technology used by the banking industry. We all need to talk through life's challenges. Talkspace offers the support we deserve at a price we can afford. Match with your perfect therapist and get $100 off your first month with promo code BRIEFING. Sign up at Talkspace.com or download the app. Don't forget to use promo code BRIEFING for $100 off your first month. The country of Singapore's digital service has developed a Bluetooth contact tracing app and will open source the underlying code so that developers around the world can build localized versions using the same basic protocol. Called Trace Together, the app uses Bluetooth on your cell phone to identify other nearby phones that have the app installed. It then logs when and how long you're in close proximity to those other phones, including timestamps. If and when an infection is confirmed, Singaporeans with the app installed can allow the Ministry of Health to access the data to build a picture of who the user may have been in contact with. Explaining why they're open sourcing the software, the Singaporean government digital service said, quote, "COVID-19 and other novel viruses do not respect national boundaries. Neither should humanity's response. In a globalized world with high volumes of international travel until very recently, any decentralized contact tracing solution will need mass adoption to maximize network effects. We believe that Trace Together and its sister implementations should be interoperable, and that's what we are building towards. These are big dreams, and success is not guaranteed. There are both technical and non-technical challenges that stand in the way," end quote. Developers who are interested in building other versions of the contact tracing app can go to bluetrace.io, link in the show notes, for more information. Singapore's finance minister posted on Facebook, quote, "We believe that making our code available to the world will enhance trust and collaboration in dealing with a global threat that does not respect boundaries, political systems, or economies. Together, we can make our world safer for everyone," end quote. Finally today, for the moment at least, unfortunately, the focus of the crisis is here on New York City and New York State, where I'm speaking to you from right now. And if you haven't read it, I want to point you to this piece from the New York Times yesterday. It's nothing more than a portrait of the last few days at a single hospital, Elmhurst Hospital Center, a 545-bed public hospital in Queens. Quote, "Doctors and nurses have struggled to make do with a few dozen ventilators. Calls over a loudspeaker of Team 700, the code for when a patient is on the verge of death, come several times a shift. Some have died inside the emergency room while waiting for a bed. A refrigerated truck has been stationed outside to hold the bodies of the dead. Over the past 24 hours, New York City's public hospital system said in a statement 13 people at Elmhurst had died. It's apocalyptic," said Dr. Bray, 27, a general medicine resident at the hospital, end quote. From later on in the piece, quoting again, "Like other hospitals, Elmhurst has come perilously close to running out of ventilators several times. Other hospitals have replenished its supply. Despite the more optimistic projections by the state about hospitalization rates, the crowds outside of Elmhurst have not thinned out. The line of people waiting outside of Elmhurst to be tested for the coronavirus forms as early as 6 a.m., and some stay here until 5 p.m. Many are told to go home without being tested," end quote. And still later, the piece notes that family members are not permitted inside of Elmhurst with patients for their own protection. Quote, "Dr. Lane recalled recently treating a man in his 30s whose breathing deteriorated quickly and had to be put on a ventilator. He was in distress and panicked. I could see the terror in his eyes," she said. "He was alone," end quote. Dr. Lane recalled recently treating a man in his 30s whose breathing deteriorated quickly and had to be put on a ventilator. "He was in distress and panicked. I could see the terror in his eyes," she said. "He was alone," end quote. Other doctors said they had tried to resuscitate people while drenched in sweat under their protective gear, face masks fogging up. Some patients have been found dead in their rooms while doctors were busy helping others, they said. Sometimes doctors try to call patients' families when it's clear they will not recover. That is what Dr. Bray said she tried to do before the man who reminded her of her fiancé died on Tuesday. As it turned out, his mother, also stricken with the coronavirus, was a patient at another hospital. We weren't able to get in touch with anybody, Dr. Bray said, end quote. Barring a miracle, unfortunately, this will be what every hospital in America, in every state in America, could be like in a month's time. And actually, frighteningly, things might only be revving up from here in New York. These might be looked back on as the not-so-horrible days 2 weeks from now. All of New York City's 1,800 intensive care beds are expected to be full by tomorrow, Friday. And since patients tend to need weeks to recuperate, those beds won't be opening up for new patients anytime soon. This is where we're at in New York. Yesterday, Governor Cuomo was celebrating the fact that the state's hospitalization numbers are only now expected to double every 4 days instead of doubling every 2 days, as was expected over the weekend. Quote, almost too good to be true, the governor said of the revised estimates. So think about that. We are so far away from being able to celebrate a day where the infection numbers drop or when the death toll numbers actually decrease. We're so far away from that we're celebrating the fact that things aren't doubling every day like we had feared. They're just doubling every 4 days. That's where we're at. And that's where we're probably all going to be very soon. That is all for today. As always, rate and review this podcast on iTunes/Apple Podcasts or wherever you can rate and review so more people can find out about the show. Thanks to Farhad Manjoo of the New York Times for yesterday tweeting that this podcast is, quote, the fastest way to keep up on the day's news, end quote. Be well, everybody. Talk to you tomorrow.